All right, welcome to episode 2.
We're going to think of a better name for this thing.
No, that's not the name. That's not the name. But it is just episode 2 of whatever the title is.
Good to be back. It
Yep.
feels a bit more exciting now that we're jumping into number two.
There we go. It's lived in. It's lived in. All right. Edward, please, would you kindly introduce yourself to any of our new listeners?
Of course. So I'm the business development manager at EpiSoft, and I'm coming to you with a couple of years' experience in the Australian healthcare sector, as well as more recently abroad.
Okay, wonderful. I'm Jeremy Griffith, and I'm coming from the experience of intern with Kyle and Jackie O. No, I'm just kidding. I work under Edward in business development. And so today's episode is about the Indonesia trip and just some of the differences, we saw in healthcare. And so, Edward, given that, you did just come back from a wonderful trip to Indonesia, I thought it might be fun to start off with, if you have a story like this, one patient journey you heard about that you felt would be surprising to an Australian hospital.
Yeah, it was an awesome trip. I was joined by Sally, who's EpiSoft's cancer application specialist. It was my first time in Indonesia, Sally's second. I think I'm the only Australian who's never been to Bali. But yeah, one big thing that did surprise me, in many surprises, wonderful surprises, I should add, was the role of social media in the patient journey. A
Mm,
lot of engagement with the patient about their care comes through platforms like TikTok
hmm
in I think Indonesia, but possibly more widely in Asia. And I think there's quite an interesting role to play and something that's not so common in Australia.
Okay, well, hey, I would love to be treated by a TikTok star who also knew their way around a stethoscope. So I think that's fantastic. Okay, so I guess just to start off, beyond that, what was the first thing that really struck you about cancer care, specifically in terms of differences about what we're more used to in Australia?
Yeah, a lot of differences. I think the patient journey did stand out as quite striking.
Mm,
Obviously, in Australia, there's you know GP navigated care, and then you go to a specialist, and then the who refers you to the treatment center. In Indonesia, from a very basic understanding, there's a lot more angles and
mm,
entrance points, including direct referrals, self referrals to the specialists themselves, without
mm.
needing to go to a GP. So that was quite interesting.
Yeah.
I know
Okay.
you only asked me for one, but yeah, the other thing
Oh,
I think
please.
from a from a longer from a longer view of conversations that I've been having is, I guess, the involvement of standards in cancer care. So in Australia, it's quite regimented. Many of our listeners might be familiar with EviQ, which is
Mm,
our home state, Jeremy, New South Wales. It's a state government supported um, protocol library,
of
and it's
course. Yeah.
basically the gold standard for uh, some parts of cancer care in Australia.
hmm
Whereas Indonesia, there's so many different standards that
Mm.
they pull from. It's usually based on the doctor's training and experience. So that was another big thing I saw in my short time.
No, I mean, that is very interesting, and because obviously in any country, fragmentation of the patient journey, it can affect the patient experience, outcome, other metrics. How did you find Australia and Indonesia compare in that regard? And what kinds of areas are they both focusing on to solve that journey fragmentation?
Yeah, there's a lot of similarities, which has been attempted to be solved by similar solutions. So, for example, one big factor contributing to fragmentation is the breadth of the care team for cancer care. So, obviously, in Australia, I talked about your GP is the primary frontline. Then you've got a specialist, sometimes several specialists. You've got
Yep.
allied health, and what can lead to fragmentation is where um, there's miscommunications or documentation gaps between those teams. So in Australia, there's a real the cancer care journey is really improved by having an advocate. If the patient has one, that could
Yep.
be family, friends, or sometimes the cancer care provider might assign one.
Mm.
And the hospital might even assign a patient navigation team as well to help
Mm.
the patient link up all those different providers.
Yeah. Okay.
Indonesia, of what I've heard, is quite similar. That there's still a lot of people involved in the journey, and where they don't talk together as best as they could, it can lead to fragmentation. So they're looking at many hospitals are investing in patient navigation teams for
Mm.
patients who don't have advocates. So
Oh,
there's a
wow.
lot of similar problems and solutions in both countries.
Wow. Okay. No, it's fascinating. And I know you mentioned that, it does happen that in Indonesia there are families acting as care coordinators. Um, what does that look like day to day for those patients?
Mm. Um, I can only really speak from the Australian experience. I think on this one, it's
Okay.
yeah, the family members often come to the patient's appointment with them. I mean, they
Mm-hmm.
have to drive them in most cases because the patient undergoing cancer care
Mm-hmm.
is usually not well enough to in many cases.
Yeah.
So that requires that carer to take a day off work,
Mm-hmm.
and it's very costly for all
Mm-hmm.
parties involved. Um, can't really comment on Indonesia from the
Mm.
limited time, um, but I suspect there's a lot of similarities as well.
Okay. Okay. And I know something else you heard about was, that there were instances of patients who delayed treatment because maybe they were uncertain about the importance of timely action and starting earlier. How did that compare to Australia? What do you think the opportunities to improve in that area are?
Yeah, this was quite a surprise. It was actually mentioned by a doctor at an event that I attended. But
Mm.
in Australia, we've come to think of national screening programs for cancer as normal or as expected. We probably take it for granted a little bit that our government constantly advertises to us
Yeah.
to take the test at home and get screened for various cancers at certain ages, and that's all generally funded by the government.
Mm.
Um, Perhaps that's something that's not as well invested in other markets,
Mm.
and so patients are often maybe a little bit unaware if
Yeah.
they're not feeling right, those early symptoms, what they
Yeah.
should do about it. But that's really consequential to their recovery and their chances of survivorship.
Okay. Yeah, no, that is very important. Okay. And so, I mean, what do you think are some of just even small things that hospitals could be doing that do make a kind of disproportionately big difference for patients navigating this kind of treatment?
Yeah, I think the answer's in the question,
Yeah.
navigation, right? I'm not
Mm.
sure if hospitals can solve the problems about patients coming to them sooner.
Mm-hmm.
I think the Indonesian government are looking into that, but if they're not already doing that. But in
Mm-hmm.
terms of what hospitals can do once the patient has presented, um, the navigation is really important.
Yeah.
So connecting with them, explaining the doctor's treatment plan with them, helping them manage getting to hospital, things like that, can make a big difference,
Yeah.
especially if the patient was a bit uncomfortable presenting in the first place.
Yeah. Okay. Yeah. And look, I mean, we know that, visibility, having a single source of truth is very important, in helping navigate those pathways, get the best care outcomes. I know a lot of the conversations you had in Indonesia, that visibility was not quite there yet. What problems did you see perhaps arising because of that?
Mm, it's quite early stage, I guess,
Hmm.
but generically, lack of visibility causes issues with obviously coordinating care, which we've talked about a lot, Jeremy, but
Yeah.
also, you know, the doctor's decision making.
Yeah.
You need to have, all the test results, the patient's history, their initial assessment, in order to make, that's just a couple of the things, in order to make the best decision. And so if
Hmm.
there's an issue with visualizing that in one place, in one convenient place,
Yeah.
then that can have a big consequence on the decision.
Got it. Yeah. And so just kind of more clear, smooth navigation for better decisions.
That's right.
Awesome. There we go. Uh,
Simply said, but hard to do, right?
yeah, there we go. I'm the what's the layman's terms translator now.
That's right.
um and look, I mean, we just went to Australian Health Week, and I think this also reflected there that in digital health, there's so much talk about AI right now, right? So much of the focus is on AI, but I thought you made a great point where a lot of hospitals, there are still huge potential gains that could be made just by standardizing processes,
Mm.
not even getting to AI yet. Um, what were some, I guess, examples of that you may have seen in Indonesia?
Yeah, that's a great question about AI. Obviously, it's super relevant to all industries right now. So much investment and attention, and AI will add so much value to patient care. It already has in things like diagnosis,
Mm,
into certain types of screening and conditions. Um, but I think in both Australia and other markets, what I've seen is that there's still a lot to gain from process standardization, which doesn't necessitate
mhm.
AI.
Yeah.
So just using standards, um, interoperability doesn't require AI. It just requires a lot of discipline,
Mm,
um, and having the right systems, I guess, from the start.
yeah.
So things like, having a shared record that all of the team can see either via interoperability or in a single system, is really important. And also using, well documented standards. I talked about the Australian EviQ, but there's many others in the world that are very high quality. And clinicians adopting those, if it's convenient to them and effective, would make a major jump in
Yeah.
the aggregate patient care.
Yeah, no, that's fantastic. And I think too that, data standardization, not just, I guess, underestimated in the impact it can have, but also in how difficult it can be to get it right. I mean, do you think that it's actually harder to get that right than buying new technology?
Absolutely. Yeah. There's so many solutions out there, particularly with the advent of AI.
Hmm.
And it's really tempting to solve a niche problem with another niche solution.
Hmm.
But actually, if as much investment and focus was on standardizing and interoperability, then we'd be a lot further ahead, in my view.
Yeah. Yeah. No, it makes sense. And you said something interesting about using data to benchmark outcomes. Why do you think that does matter for a clinic when they are trying to compete regionally?
Yeah. I mean, data is really, of course, the currency of demonstrating competitiveness. So, um, if in a competitive environment when there's so many quality providers in, regional neighbors,
Hmm.
being able to use the data to populate quality indicators that you
Yeah.
can communicate to potential patients, referrers, becomes really important.
Yeah.
And it helps navigate maybe those biases where, oh, this country has always better cancer care than we have at home.
Hmm. Okay. Yeah, and obviously, like, we know the standards are important, the technology is important. Another thing that can kind of get glossed over is just the human ability, right? Discipline. How important do you think that is in just getting teams to consistently use these systems properly?
Yeah, it's significant role. If there's leadership in a disciplined approach to systems and processes, that's almost more important than what the system is. You
Mm,
know, um,
mhm.
You can have different opinions. That's normal. That's human behavior in the team around how they should do something. And they might have seen something over at hospital X that they think that hospital Y should adopt, but
Hmm.
hospital Y is already invested in something else, and so that continuity is important
Yeah.
to achieving the outcomes. If everyone
Yeah.
needs to be really on the same page.
Yeah. Okay. Yeah, and looking at it, I know too, some of the doctors and clinicians in Indonesia were mentioning that there are instances of patients, medical tourism to Singapore. They're traveling all the way over there just to get cancer treatment.
Mm,
Why do you think that is, or why did they think that's the case?
yeah, just from what I've heard,
Mm-hmm.
there's, I guess, perceived better quality of care
Mm,
in Singapore, but that was really just a throwaway part of the conversation. We
yeah.
didn't really get to unpack why
Yeah.
patients understood that. There was mention of potentially the role of social media in
Yeah.
promoting the quality in Singapore was better.
Mm,
But yeah, from what I've seen, there's very high quality institutions in Indonesia. So
yeah.
potentially there's a perception versus reality issue going on.
Right. Okay. Yeah. And I mean, if it was just mentioned kind of in passing to you, it must be something that's just so taken for granted, I suppose, right, within the health scheme, which it shouldn't be, right?
Yeah,
I mean,
because we
yeah.
all you know we all believe in care powered by evidence, right? Best
Hmm.
practice.
Yeah.
So why should our understanding of the best providers be any different?
Yeah. 100%. And what do you think that, local hospitals within Indonesia would have to do just to show patients that, hey, you can receive that same standard of care without having to get on a plane?
Yeah, tricky one. Is much broader than my sphere of knowledge,
Mm,
but I think there's a role to play around the use of data that I was talking
hmm.
about before to demonstrate, well, actually, we're getting the same outcomes
Hmm.
as if you had gone to Singapore. Um, the way that's communicated, you know, there's so many factors affecting that. You know,
Yeah.
the literacy, the patient's preferred channel to receive that information, and also, there was also mentioned to me about ethics. Right?
Yeah.
There's as a doctor, even if you are right, how do like within your ethics, how do you promote that?
Yeah. Yeah. And so it's kind of sounding to me like it's like first, we got to get the standardization and kind of the patient journey, right? The navigating the care. And then once that's adequately sorted, then we got to do a TikTok overhaul and let them know exactly what they're going to get now here at home.
Yeah, well, potentially. I have to say I'm a bit of a luddite with social media myself,
Yeah.
but yeah, it's a real unknown to me. But
Yeah.
Indonesia and other neighboring countries, they're very well versed in it, and so I look
Yeah.
forward to what they set out to do to
Yeah.
demonstrate their competitiveness.
Yeah, definitely, definitely. Yeah, and so like I mean it does sound like a bit like obviously the care is one thing, but also it sounds like there's a lot of potential within just the branding and the awareness, right? And the way that it's communicated to average people in need of healthcare. And I think
Yeah,
that's great. Yeah.
absolutely. Something we're not so familiar with in Australia.
Yeah, yeah, it's true. You guys might lose me to Indonesia. No, I'm kidding. And a lot of the discussions too we've been having with Indonesian providers and services, it has been around what we've touched on the international protocols, EVIQ, NCCN, and just why are these standards so important, particularly with complex care like cancer care?
Yeah, because simply put, the evidence is always evolving. Um, an individual clinician sitting in their chair in a
Hmm.
consult room um, has so many responsibilities,
Yeah.
They spending time with the patient. There's obviously a requirement for continuing education in many countries, but you're limited to the time and
Mm-hmm.
resources of one person
Yeah.
to keep up with the evidence. But standards exist so that the clinicians can get the power of many
Yeah.
right at their fingertips. So, like, I can only talk about EviQ and the process there, but because I'm most familiar with it. But the they have a panel of experts from all different parts of the cancer care team to
Mm-hmm.
come together regularly and discuss what are the latest clinical trials showing about the effectiveness of certain treatment plans and protocols. Okay,
Mm-hmm.
so should we now update the standards? And then if they make that decision, then those standards can be made available very quickly to
Mm-hmm.
those clinicians who are sitting in their chair and making decisions. So
Yeah.
it's leveraging, the community, the science research community, in a very regimented framework to actually improve point of care prescribing.
Yeah. No, that makes sense because I know too we were talking about, particularly in Indonesia, there's just so many people that oncologists and other healthcare providers are greatly outnumbered. And it was kind of seeming like maybe the kind of, what's the word? The most impact that could be had in the shortest term is just helping them. Like, let's say they're treating 8 patients in a day currently. If through infrastructure and support, they could be treating 80 or 800 or something like that. Um, is that kind of in the realm of what we're talking about?
Yeah, I mean, I wouldn't want to tell an oncologist to have 800 patients a day, but I think they'd be very unhappy with
Treat the
me.
city.
But yeah, there's certainly a big shortage of specialists in Indonesia. Um, there's they're completely overwhelmed,
Yeah.
from what I've seen, and so I think the value proposition of having standards is
Yeah.
instead of doing all the research themselves, just
Hmm.
outsource it to standards.
Yeah.
So if someone comes in and they are indicated for a particular protocol,
Hmm.
then there's less second guessing
Right.
and
Right.
self research. I had one. This is just n equals one. One story, one conversation with an oncologist who was googling the
Mm.
answers, or
Mm.
googling the
Hmm.
treatment decision that they were making about a patient, and
Wow.
that's
Yeah.
you know a bit unconventional, and so
Uh,
the standards could be used to provide them a very reliable, quick answer.
yeah. Yeah. They should have at least used Chat GPT. No, I'm kidding. But no, I think it makes a lot of sense. Yeah, it's just making sure that they're able to more quickly, accurately come to the best decision, get this person the proper care, and then move on to getting the next person the proper care they need. And what role can digital systems play in helping hospitals to clearly do that and to clearly demonstrate um, to their population the quality and outcomes?
Yeah. Well, I mean, systems exist to standardize and aggregate.
Hmm.
Um, they're designed with databases that can help you compare what's the outcomes measured across many patients.
Hmm.
So it's very fundamental to demonstrating quality and outcomes that you just can't do on paper.
Yeah.
You need to have the right data to get the right question answered.
Yeah. Okay. And I mean, when it comes to cancer care providers from different geographies, Indonesia, Singapore, Australia, how do you think we can work together to collectively improve that cancer care?
There's so much we can do. This is a passion project of mine. The whole reason that we started getting involved with Indonesia is because of
Hmm.
the so much collaboration going on in many industries and at government levels, Indonesia and Australia.
Hmm.
Um, and we're both very aspirational, and
Yeah.
there's different things that we do very well.
Hmm.
And the benefits of working together are much better than working siloed and standalone.
Yeah.
But
No, that's
some
me.
specific things that they can do,
Hmm.
I think, are sharing standards.
Yeah.
So establishing partnerships where we go, all right, we're going to pick. a particular protocol standard, treat our patients using that standard, and then benchmark, right?
Yeah.
And then if there are differences, why are there differences? If you operate on different standards and in silos, it's very difficult to do that.
Yeah.
The other thing I think that could be important are obviously MDT, multidisciplinary team meetings,
Mm-hmm.
are more commonplace in most hospital processes now. And
Mm.
with the advent of webinars and video technology like this, we
Mm-hmm.
can facilitate those MDT meetings much more easily. So
Yeah.
why can't an Australian and an Indonesian and a Singaporean um, oncologist or cancer specialist
Mm-hmm.
collaborate on MDT together?
Yeah, no, that's beautiful. And also, I want to apologize if there's any listeners that are not in Indonesia, Singapore, or Australia. Also, you, okay? We all work together to improve cancer care.
Yeah,
Um,
I suspect these are all global problems.
yeah,
Cancer's on the rise everywhere. It's a costly
yeah,
problem,
yeah,
um, not just from financial point of view, but from quality of life, right?
yeah,
So I'm very passionate about any collaboration we can do
yeah,
between any country in the world to help with the problem.
yeah. No, I think that's beautiful. And just for fun, a last question, Edward. What it could be healthcare, it could be non-healthcare. What was your favorite thing you loved the most during your time in Indonesia, dealing with all of these wonderful healthcare professionals?
Yeah, has to be the hospitality and the approach
Yeah,
to fun.
yeah.
Yeah, often in Australia we tend to be more serious,
Mm,
but I love how Indonesians work hard, play hard. Um,
mm,
you know,
yeah,
it diffuses some of the barriers in these serious topics.
yeah,
And we were over there for a particular customer implementation, but they were so hospitable, and they really spoke to my values and the values of EpiSoft
yeah.
around family. And I think
Oh,
that was really, it just felt right.
that's beautiful. I love it. Well, thank you, Edward. Thank you, Indonesia.
Yeah, absolutely.
Yeah, and thank you everyone for listening. We hope again it was useful and that there were some, just some good points in here. So we can just keep on all working together to help more people. And until next time.
Thank you, everyone. Hope you join
Yeah,
us in the next one. Thank you.
thank you. Yeah.